Hi, I'm Michael Hoxton from HoxtonHealth.com, and today I'd like to talk about, sometimes I get asked, Michael, what exactly do you do? Are you a physical therapist? Are you a Czech practitioner? Are you a personal trainer? Are you a nutritionist? Are you a shaman? What do you do, Michael? Well, today, right now, I'd like to share how I would answer that is I help people basically feel more comfortable in their body. So part of that, with what I want to talk about right now, is sometimes there's a condition where somebody has a increased thoracic kyphosis. Thoracic spine meaning the middle portion of the spine, of the back. And with that increased thoracic kyphosis, there's usually a lack of thoracic extension, bending backwards basically, coming from this portion of the spine. Now, sometimes you'll see these cases, not sometimes, very often, is in the bodybuilding population, where the bodybuilding population, they want bigger global or outer muscles, so to speak, the big pecs, the big delts, arms, legs, lats, etc. So what happens is they overdevelop the latissimus dorsi muscle, which are the lats, or the wings, you could say. And what that does, where those attachments and origins of those muscles, has a tendency of pulling the thoracic spine into more flexion, or kyphosis, okay? And it protracts or rounds out the shoulders and brings the head forward like this, and they have the upper traps pumping away, and they look kind of like this, okay? So over time, that can cause a decrease in the movements outside of that, or the opposite of that, which is extension, or moving back like this. So what I commonly see in men more than females, in men I usually see they'll have an increased kyphosis. They're hunched forward like this. The head will become forward like this. Sometimes they'll have, even though they'll have strong abdominals, they'll have a poochy gut. They'll have some flab or skin hanging over. Okay. And now I'm not talking about these are lazy bastards. These are people that exercise regularly, that watch their diet, and they've done cleansing, detoxification, and they just have this posture all their lives that are contributing to this poochy gut, so to speak. Now, what I find is you could do the diet, you could do all these other things, but also structurally you could address what's going on in that thoracic spine, or if you call it the thoracic cage, because the rib cage attaches to the thoracic spine. So there are several things that I've found which normally when you go to a manual therapist and you have some pain in the neck or the shoulder, that could be contributed by rigid thoracic cage. And the normal type of therapy is manual therapy, soft tissue work with the mobilizations to improve extension, followed by a lot of neuromuscular re-education with stretching and corrective exercises, let's say. So let's say you've done that and there's still a lack of mobility going on in the thoracic area. So I found, not in all cases, not in all patients or clients, but the ones that do qualify, generally the ones that are a little bit more active, by putting your upper extremities in more of a closed chain, or your hands stable against the floor or in that closed kinetic chain situation, whereas they're normally open chain, they're not really connected to anything over here, is that helps stimulate new neuronal networks in the brain, in the nervous system, to allow for whatever's creating stiffness in the area to loosen up and to stimulate all these other muscles to work together and all the structures to work together in a way that it's not accustomed to. So things, what I mean by closed chain exercise with the hands, with different, with varying positions of shoulder movement, things such as handstands, okay, some yoga inversions, headstands with the elbows up, scorpion, these type of movements where instead of we're used to standing on our 2 feet, we're actually standing on our 2 arms. It's a different stimulation, it's a different way of thinking. What I found, especially with handstands, is that immediately, almost immediately, opens up the thoracic cage. Now, I wouldn't do this if somebody has acute shoulder pain, but as a way to when they're in their post-rehabilitation phases, or as a way to prevent future shoulder pain, where they are showing some signs of stiffness there without symptoms, the handstand is a great way of doing it. Another thing is when you lack that extension or mobility in the thoracic spine and you're always hunched forward like this, you're closing down on a lot of the energy, and that's what collects over here in the gut. Okay? So even though you've been watching your diet, been doing all these exercises or whatnot, and you still have a flabby gut, so to speak, okay, and you've addressed all your hormonal issues and parasites and all that other stuff, by opening up the thoracic cage, the rib cage and thoracic spine, that gives a new pathway or avenue for energy to flow upward. Okay? Right now, it could just be an old habit in the body, in the intelligence of the body, just to keep everything here because that's all it knows. Because think about it, every day that we're upright against gravity, we're standing upright against gravity, where it's pushing down on us after a while, so we get tired. Now, when you open this up here, you open all this up over here, after a while, that lets all this energy, all this stagnant, heavy energy, lets it flow to the higher energy centers, or chakras as you would say, so that that could be further expressed. And the person can gain more clarity, they can gain more movement, they're more expansive as compared to being contracted. So what I'll demonstrate in the next segments are just some movements that randomly I'll put together that I find have been very helpful to help open up this thoracic spine, this thoracic rib cage, so to speak. All right, so I'll cut to the next segment.